are joined by Dr Natalie Rout, it's time for your chance to call the doctor today. And today we're going to be focusing entirely on your ears. So if you've got anything that's concerning you, from infections to loss of hearing, earache, tinnitus, give us a call now. 0207 862 2222 is the number that you need, and we'll put you straight through to the doctor. Now, Toby, you've got issues with your ears. You're one of the You're one of the 7.6 million people.
I'm so surprised there are that many people that have tinnitus. That's quite common. 7.6, and I really feel for some people who have very bad tinnitus. I've got a friend of mine who, you know, she can't sleep. She has constant insomnia, and that just affects her whole life, which is horrendous. I've got tinnitus in one ear, and I think it's just coming on a bit in my left ear as well. And although I work in music, I have headphones on every day to a radio show. I play a lot of live gigs. Normally my monitor up too loudly. Like, Toby, turn it down. And I've been exposed to that for a long, long time. But ironically, my tinnitus came on from a diving, not an accident, but I was filming underwater for a TV show about 20 years ago. And I went down, did the filming, waved at the camera, came up too fast and didn't equalise. And I got out of the pool, and 10 minutes later, I was fainting. Like the bends was coming on, and I felt sick, and it was horrendous. The next morning I woke up and I had this high-pitched noise in my right ear. So I went to see a specialist, and he said, you've had a barrow trauma to the ear from the diving, and that's brought on the tinnitus, which essentially is, you can clarify this, but it's tinnitus is deafness, isn't it? It's deafness to certain pitches, isn't it? Is that right?
Not necessarily. So you can experience tinnitus in multiple ways. It can be like a ringing, a humming, can even be sort of like what we call a pulsatile sound, like a whooshing. It's a symptom, but there can be so many causes of why people get tinnitus. Sometimes it's really difficult to identify what it is, but there are so many that can actually be fixed potentially.
Oh, really?
Yeah. That's so we always say, we talk a lot about tinnitus because, as you said, so many people suffer from it, and a lot of people are suffering with it long term and not really able to fix it. But if you do get it, you should always be seen by your GP so that they can look in your ears first and look to see if there's anything visible that they can fix, like wax. So simple. Get your wax taken out, your tinnitus goes.
Does wax bring on tinnitus then?
Yeah, it can do. Some people can, yeah.
And you said it wasn't that, but can listening to loud music and being exposed to that do that? I mean, I obviously know a lot of musicians. And my husband was in a band which was famous for playing music very loud. And people will joke with me, oh, my ears are still ringing from the 70s and 80s when I heard your husband's band. He doesn't have tinnitus, but Dave Hill in the band actually does have tinnitus. Well, look, so I wonder if I always wondered if it was directly connected.
Well, look, we've touched on what tinnitus is. It could be a ring in your ears, a pulsatile tinnitus, perhaps going rhythmically alongside your heart, whooshing. That's the type of tinnitus I've got. I can hear whooshing, and it can affect your sleep. Sort of difficult to get to sleep. Of course, that can impact your life. We're going to give you a little bit of a taste of what it sounds like. We're going to listen to what tinnitus sounds like. Now, it is quite an unpleasant sound, so just a warning, you might want to turn your volume down now because it is quite an unpleasant sound. So there are lots of different sounds of tinnitus. So if you turn down your TV a little bit, here's just one example of it. I mean, that would be very difficult to sleep through if that's
like
going...
I've kind of got that. The bizarre thing I find is that sometimes it's worse at certain times, and other times it just kind of levels out and it blends in. Whatever that pitch is, and it's different for everyone, it blends in with the environment a lot of the time. But when I go to sleep, I need to have white noise.
Yes.
Oh, really?
So I have a fan on every night, which costs me a blimmin' fortune on electricity. But
this is a really common thing.
I need the noise going.
I heard of somebody the other day who goes to sleep with a hairdryer. How dangerous is that? Well, having a hairdryer running all night just because they need that white noise sound.
You can buy a white noise machine.
Yes, I think there must be an app.
You can get it on an app as well. I've tried it, but it didn't work.
Don't leave your hairdryer.
And Natalie, what does the white noise do for people?
It's essentially... two ways it might work. It is distracting you from focusing on that sound that you're hearing, and it's creating extra noise so that basically that particular pitch is just, the brain isn't hearing it as strongly. So a lot of people do actually find that their tinnitus is worse at night, when it's quiet, when they don't have anything else to focus on, that's when it's worse, or in sort of very, very quiet environments. So
I have to say, particularly I think for everybody I know who suffers from a little bit of tinnitus, and it's amazing how common it is. We've been discussing it in the office, so many people saying, oh yeah, I've got that too. But yeah, at night, when everything goes quiet, that's when everything starts. But look, there's so many people on the lines that want to speak to us. I know you two can ask questions for the next hour.
Whether lying down made any difference, because your ears are so connected to balance. Does lying down make any difference to tinnitus?
Depends what sort of tinnitus. So pulsatile type might be worse when you're lying down.
Sometimes propped up might help,
but not necessarily.
OK, let's hear from Dorothy, who has got in touch from Birmingham. Dorothy, welcome to the show. What is your question?
Thank you, Alexis. Hi, Doctor. I'm suffering with itchy ears, just sort of outside the ear, and I've been putting Savlon on a little bit, and it seems to have helped a lot. I was just wondering if I'm doing the right thing.
Dorothy, when you say it's sort of on the outside, can you see which bit's itchy, or is it in the canal bit? So is it in... We've got a nice little prop here.
Here you go, Doctor.
I don't know whether you can see it. I'll pick it up for you. Is it in this bit, or is it in this canal bit?
It's just... it's not into the canal side. It's just on the outside of...
OK. And do you see any skin sort of dryness, flakiness, redness? Can you see anything like that?
No, it's been weeping a little bit as I've scratched, obviously, and it's sort of caked over. But like I say, I've been using the Savlon, and it seems to have eased it. But am I doing the right thing?
Well, the answer really depends on what's causing the itchiness. So if you've noticed that it's sort of scabbed over, it might be because that area of skin is really dry. A really common reason why people get itchiness is actually because of ear eczema. Sometimes some slightly other conditions like psoriasis can affect the ear, not just the outside, but the inside as well. So if you're noticing that it's a bit dry on the outside and it's been flaky or scabbing, rather than using Savlon, I'd probably just use a really simple moisturiser. Savlon has an antiseptic sort of way it works, so you're not doing any harm by putting it on. But if you're noticing it's a bit dry, you can't necessarily see any rash or any redness, but just try a little bit of moisturiser. If it's not getting better, see your GP.
Dorothy, thank you. Let's take another call. Vasilis in London. Vasilis, welcome. What's your question?
Hello, Alexis. Thank you very much for taking my call. I'm a regular swimmer, and I've recently started experiencing some discomfort whilst swimming, and also it continues afterwards. I pop my ears like you do on an aeroplane sometimes, but it's only in one ear. And I had tried a bit of olive oil in the ear, but I've noticed that when I'm swimming now, it feels more discomfort. So I've bought some of those swimmers' earplugs, which I tried a couple of days ago. It still seemed to be letting a little bit of water in, and it feels like even afterwards I have to squelch. My ear feels a bit squelchy.
Has Vasilis got swimmer's ear?
Potentially. So the reason it's called swimmer's ear is because it's very, very common in swimmers. But essentially, I'm going to bring up this model again. But what swimmer's ear affects is this external ear canal. So the canal going in, because water goes into that ear canal very easily. And so you can get inflammation and buildup of debris in there, and repeated water deposited in the ear can just make things worse. I would really advise you to get your ears looked at by your GP, because olive oil would treat wax, not going to treat any sort of infection of the external ear canal. You might have an infection that needs drops that are prescribable. And also I would recommend you give your ears a bit of a break from the repeated water touching the canal. So maybe not swimming until you've had it checked.
There's a conflict of kind of advice you're given about that, though, isn't there? Because I had an ear extraction just 2 weeks ago, which is not being syringed. It's where they kind of they
put a machine.
They suck the wax out.
They basically hoover your ears.
And it was very painless, and it was very quick, and it worked really well. And I have had my ear syringed way in the past. And the person who did the extraction said, her advice was never ever put drops or olive oil, anything like that in, because which doctors always used to tell you before you had your ears syringed, put drops in to soften it.
Or cotton bud, never. I was told off.
But she said never put anything in because all you're doing is melting the wax and driving it further in.
No.
Is that not the right?
Oh gosh, here we go.
Or doctor, this is the
or a
conflict.
cotton bud as well, because that
Never
pushes
use
the
a
wax
cotton-
in.
Never use a cotton bud.
Yes.
No cotton buds.
So what's the truth?
If you do have wax buildup and it's causing you pain, or it's causing you hearing problems, or it's causing tinnitus, or the doctor needs to look at your eardrum because obviously the wax is blocking it, then often the first thing we say is use wax drops to soften it, and then it melts out. If we look at the
What
ear,
if it does go? It seems it was logical to me that it
Hang
went.
on. Let Susan, let the doctor
This
explain.
model isn't complete because we're trying to look at all of the parts of the ear. But you've got the canal here, and here sits your eardrum. So when things go in your ear, they don't go into the middle ear or the inner ear because you've got a drum blocking it.
Yeah, but what she was saying was it goes so far down to the drum, she then can't get it out as easily because it's gone further down. I know it doesn't go any further. I didn't think it went into my brain. I mean, that's not what's happening.
Okay. So, what about, we've talked about olive oil, which, again, I was going to, went and had my ears hoovered, vacuum cleaned, and they did say, use some olive oil just to soften it. So I was given from different advice. But we always see other things that are out on the market, things like these candles. I think we've got a picture of some of these candles that people put them in their ear. There you go. They put them there and they light them, and they're meant to draw out. Look at that. The doctor, your face you're making, Natalie, is one that is not very encouraging.
It makes me so uncomfortable.
Right, you shouldn't do those.
Why? My question is why? Why would you put yourself through something that is potentially more dangerous than using something simple like a drop? Not necessarily olive oil if it's not worked for you, but there are other drops that we do prescribe which are better. They're sort of, we call it like a dynamite for dissolving earwax, or going for something like ear irrigation, which is in the right person, it's actually quite safe. But here you've got a naked flame. The wax is hot. You're probably dripping wax into the ear. The wax can burn you. You can burn your hairs that are really, really very useful for your ears. Your hairs help to move things out, bacteria, germs, wax, debris. So actually it's more dangerous, and there's no evidence that it works.
All right, so let's just deal with something very quickly, because a lot of people will have remembered having their ears syringed. That doesn't happen anymore. They use those tiny little sort of suction things to get them. But GPs don't do that service anymore. You guys don't do it anymore. So if you're out there and you're thinking, hang on, maybe my tinnitus is coming because of the build-up of wax in my ear or any of the difficult, and I need to get my ears cleaned, where do you go?
You first have to see a GP to ensure that that is the cause.
Okay.
Because yes, wax is a very common cause, but there are lots of other causes as well. So your ears might be clear when the GP looks in them. If they're clear and you're getting this recurrent tinnitus, then you're probably going to be referred to a specialist who can look in a bit more detail for other causes, maybe get you a hearing test just to check that it's not your hearing that's causing the tinnitus, because you're quite right, they are linked often. There's another condition called otosclerosis, which is essentially stiffening of one of the bones of the ear. So again, I'd love to use this little model here. You might be able to see this little stirrup-shaped bone that sits in the middle ear. That can become stiff. And when that becomes stiff, you can notice that your hearing is reducing because it affects your hearing, but also it might predispose you to tinnitus. And that can be reversed. So you can have an operation to have a little prosthetic put in instead of that stiffened stirrup-like bone.
This is what I wanted to ask you, because it seemed to me, although you've just kind of mentioned that you can have things healed, that the ear is somewhere that surgeons should stay away from because it's too... Well, in terms of deafness and tinnitus and things, because when you think about, you know, you can have your eyes, you can be partially blind and have them lasered and fully corrected. You know, you can have a brain operation while you're still awake. But it seems to be, I was under the impression that you can't go in, you can't fix ears and you can't fix deafness, but you can fix eyesight and you can fix brains, and it just seems amazing.
Can you have procedures to correct these things?
You can, absolutely, and they're done with amazing techniques, with sort of lasers and really, really, really tiny, tiny instruments. So there are operations that can help, but not for everyone. So I don't want the 7.6 million people suffering with tinnitus to go to their GPs and say that, I saw a doctor say...
Where are your lasers? Get them out.
But I didn't know that. that's encouraging,
But it
though.
can, yeah,
The thing that you
absolutely.
might have a problem and it might be fixable. It might be
Okay.
It could
There's so many people calling to talk to us that we're going to continue to take your calls. But let's take another one quickly before the break. Maxine is waiting to speak to us from Kent. Maxine, welcome to the show. What's your question?
Well, good afternoon. Thank you for having me. I do suffer from tinnitus, and I've had it for 9 months, but I also suffer from vertigo from time to time. I've had an MRI scan, and the MRI scan said there was nothing wrong with my inner ears. Is there something else besides that? Because I'm now on a sort of antihistamine, which is called cynarazine, and I take that 4 times a day, which makes it slightly better. I can go a week without having a vertigo, but then I do get one, and it's not very nice, and I'm sick, and my tinnitus then goes up, my anxiety goes up, and the tinnitus actually pulsates with my heart. It's there all the time, and it's like a wave. It's just like a wave, a shush. But when I sort of, like now talking to you, my heart is pounding, it's going jung, 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 jung. So I'm wondering, I've seen an ENT, I've seen actually 2 doctors on it that can't find anything wrong with that. They've given me the sort of where they sling you around on a couch. They've also said it's not Meniere's disease, my ears, and there is nothing sinister in the MRI. So I'm sort of at a loss now, please. Is there anything else I can do?
Okay. Doctor, what can Maxine do?
Thank you, Maxine, for sharing that with us. I'm sorry, you're suffering with quite a few things there, but you raised some interesting things. So the vertigo associated with tinnitus and often with hearing loss can be a sign of something called Meniere's disease, which you sound like you've ruled out for yourself. And that's something that's important for people to know because, again, it tends to occur with age. You notice hearing and your episodes of vertigo where you feel like you're spinning or the room spinning around you, and can be very, very off-putting and really quite awful to live with, but something to be discussing with your GP. You've also mentioned, Maxine, that you're feeling a pulsatile tinnitus, which is slightly different from the sort of ringing that we heard earlier, or the whooshing that you described, Alexis. This sort of pulsatile, rhythmic nature of tinnitus is often related to sort of blood circulation. Have you had your blood pressure checked?
Yes, I've had the blood pressure tested. The doctor I saw was a private doctor, and they took me off. I'd been given too much to bring my blood pressure down. So he took me off the pill, which it seems now has made this slightly better. I've had all the other blood tests done. There's nothing wrong with my thyroid, with anything else. I'm just wondering if within the inner ear, and from you, please, if that MRI, is there another scan I can have that will show whether it's a sort of liquid in the ear, or what you said earlier on, which I'm very interested in, because one of the the ENT doctor, private doctor, because I couldn't stand falling over all the time, said that get some hearing aids, which I did, didn't make any difference whatsoever. Looked up my past hearing test, and my hearing hadn't gone down within 2 years from the last test, so that was ruled out. Everything has been ruled out, bar 2 tests I've had now for a higher test for thyroid, but I don't think it's that.
Very good.
Okay, Maxine, I'm going to have to go to a break in a moment. Is there anything else that Maxine should be doing?
It sounds like she's actually had quite a good workup with the blood tests, looking for other things that can cause it. Her medications being reviewed, because I didn't actually mention, but medications can be a reason for tinnitus, so your doctor should be reviewing them.
Like, what could step? I'm sorry.
Save it for the break. You can ask your questions on the break. Right. Look, Maxine, thank you. Look, don't worry. We're going to pause there. Keep your calls coming in because we're going to be taking a lot more of them after the break. So let's kick off with Angela in Essex. Angela, welcome to the show. What is your question?
Hello, Doctor.
Hello.
My name's Angela. I've got a syndrome, and I can only call it poppy ear. I've had it for years and years. It's my left ear, and it'll pop, and it won't go. It'll be there all day. It's like a wind gushing through my head. I can hear my myself breathing. I can hear everything I talk is echoing. And I'm just going to quickly give you 2 instances. It seems to be at events. 10 years ago, at my mother's funeral, we had so many people, I had to spend the whole day talking to them with my ear echoing and gushing. 2 years ago, when I lost my sister at her funeral, the same thing. Woke up in the morning, ear popped. Was there for the whole day, trying to talk to people with this echo in my head. I've been to audiologists. No one wants to know. I went earlier this year. They did all tests. There's nothing in my ear. There's nothing wrong apart from a bit of bad hearing. And I said, have you heard of this before? They said, no, never heard of it. Pass me off. No one wants to know.
Oh, Angela, I'm so sorry, and I'm sorry for your losses. I think it does sound like both of your losses made things worse. And I wonder, you know, would you agree that those were quite traumatic times for you? And
Well, I would, yes, but it's not just that. It happens anyway. It happened last Saturday when I went shopping. So I know. I just thought I'd mention that.
Yes, yeah. Well, have you been asked about sort of your nose, whether you get any sort of blockage in your nose, whether you get sinusitis or anything like that? Do you suffer with anything?
No. Nobody seems to want to know. Even the audiologist, when I say, have you heard of it, they just say no.
No. Well, actually, you can get something maybe slightly similar to what you're describing. That sort of ear popping that you're describing is basically the pressures changing within your ear. So that if you've ever been on a plane before, you might notice on takeoff and landing that as the pressure changes, is it a similar feeling, Angela, to that?
Yes, but normally if that happens, you can sort of hold your nose and pop it and it clears.
Yes.
But with mine, it's there all day. It won't go till I wake up in the morning.
Well, I wonder, it might be something worth trying, because if it sounds like it's similar to that sensation that you get when you're flying, to try something like a steroid nasal spray. Now, you might say, why the nose? Why not something in my ear? Well, if I get my trusty model up again, the ear, nose and mouth are quite closely connected. So this thing here is called the eustachian tube. So often, and it connects to the back of the nose and the mouth and the sinuses, if you like. And when you have any congestion building up in that area, it can give that feeling of fullness or pressure in the ear, that you might feel like my ear is blocked, and then you might feel like you have to pop it to release some of that pressure. And so what a nasal spray will do is reduce the inflammation in the cavity in that eustachian tube, in the back of your nose and the back of your mouth, and it might help. Maybe something to give a go if you've tried other avenues, Angela.
Angela, thank you for your call. Let's move on to Faith in Essex. Faith, welcome to the show. What would you like to ask?
Good afternoon. I have a similar problem to the lady before me, but I haven't got any. I don't think it's tinnitus. They haven't mentioned tinnitus at all. I did go to the hospital, ear, nose and throat, and they are going to send me for a CT scan to look at my temporal bone. And I get a bit of giddiness. I'm a bit frightened to go in the garden in case I fall. My heart beats all the time, even when I'm standing up or sitting down. And it's just driving me mad. It's awful, but I feel fine.
Is it that ringing that you're getting, Faith?
No.
You're not getting that?
No. Echoing.
Echoing, yeah, okay, echoing.
What is the echoing?
I guess that's a form of tinnitus, really.
It's a form of tinnitus, is it?
Yeah, it could be a form of tinnitus. I'm not sure what the CT scan is looking for, but I'm glad you're seeing a specialist, because they're the best people to deal with it.
Where is the temporal that she meant? The temporal
It's in the skull. It's
so
part
that's
of the skull.
kind of part of the above the ear, is it? The temporal. Yeah.
Can I just with tinnitus? Yeah. Does it get worse over time?
It
or
can
does it level? Does it stay at a level?
It can go away. Some people might have it for 2 years and then it goes. Some people might have it for 9 years. Some people might have it lifelong.
Does that depend on the cause of it, though?
Not necessarily, because sometimes we can't identify a cause. There are those cases where we can't identify a cause. So, yes, I guess if it's something that's treatable, great. It may go away very quickly. It may take a little bit more time to go. But if it's a cause that we can't identify, it's not necessarily related to how long you're going to suffer with it.
You can also get people that suffer from tinnitus. I've read that sometimes CBT works for people, cognitive behavioural therapy.
Yeah.
How does that work with?
Absolutely. Very interesting. So sound therapy or CBT, both can be used. Sound therapy, like we've discussed, is putting on
white noise,
machines, so some music, even just having the radio on can help. CBT, so again, it goes back to what is tinnitus. It's this, you hear a ringing that other people can't hear. It's not a noise that's being externally generated, unless it's coming from that pulsatile, the rhythmic one that we discussed that comes from your blood vessels. So it's something that you're hearing, and it's to do with the signals that go from the brain via the nerve. You can't really see much of it here. I won't focus on the model, but it's to do with the brain processing sounds and telling you that you're hearing sounds. So CBT works for you to try and not think about
distract
the sound.
you from it.
To focus on other things.
OK, I just want to squeeze in one more call before we give some general ear advice and ear health. Teresa in London, welcome to the show. Teresa, what's your question?
Hiya, everybody. A few years ago, 2 or 3 years ago, I got terrific pains in my ears when I go to, well, it's, I go to sleep okay when I go to bed, but it wakes me up and it's so excruciating. But then when I turn over, it's immediately, it goes. I had it quite badly at one point and I went to the doctors and who sent me to the hospital, and all the doctors said was get a softer pillow. Well, I wasn't really happy with that, but because when I got a really bad attack, next morning I look in the mirror and my ear is totally inflamed and enlarged. But anyway, I got an orthopaedic pillow and it's improved it a lot.
OK, Teresa. Thank you, Teresa. What do you make of what Teresa was telling you there?
I'd love to know a little bit more because it sounds, from what she's saying, Teresa's getting pain. There can be lots of causes of pain, but then she's mentioned she's had a swollen ear. Now, again, there can be other causes of why you might get a swollen ear, which would maybe need some blood tests done and that sort of stuff. But if it seems to have resolved with a softer pillow, then
can pain in your ear come from your jaw as well? If you're sleeping and you're clenching your jaw at night, can that cause issues?
Yes, because your nerves, you can get referred pain, which is where your nerves are connected to various places in your skin and the muscles, and so you can get pain in other areas from your jaw, absolutely.
I'm conscious that we're all out of time, literally got seconds left, but if you are experiencing any discomfort, pain, first port of call, your GP, perhaps even your pharmacist now that they're kind of able to give you GP, I can see in your face.
GP for this, because you need your ears looked at. But there are lots of other reasons why you should see your pharmacist. But for this, you need someone to look in your ears. OK. Look, thank you so much. That's it for today. Thank you to Susan, Toby. They've been brilliant. Dr Natalie, thank you. Lovely to see you. Jeremy is back at 9:15 tomorrow morning. Have a